We conduct this study first because the gender topic is a very hot topic at the moment, especially in cardiology. Many differences are found between men and women at the moment in cardiology. And we conducted a randomized multicenter trial between functional testing and cardiac CT. And because it's known that the accuracy of the functional test in women is much lower than in men. For example, the exercise test is known to have a lower sensitivity due to non-specific ST segment changes, and also the nuclear imaging test is known to be less accurate compared to men. So with that knowledge, we thought that cardiac CT could be more effective compared to functional testing, and that was why we started this sub-analysis. The pretest probability is, of course, the probability of having coronary artery disease before you do a test. Based on the story the patient is telling you. So people who are having a very low pretest probability are young women with very non-specific angina complaints. And patients with a very high pretest probability are old men with very typical complaints and a lot of risk factors. Yeah, so that's how you decide the pretest probability. The primary endpoint of the trial was the clinical effectiveness, defined as the absence of chest pain complaints after 1 year. And we found that the women reported 40% of women reported no complaints after 1 year of follow-up, in comparison to 22% of women in the functional testing arm, and that was significantly different. While in men, we saw no difference between the CT group and the functional testing group. Yeah. What we found was that the prevalence of disease was lower in women, and also the calcium in the coronary arteries was lower compared to men. So probably because women, that causes that the doctor and also the patient is more reassured that there's nothing wrong with the coronary arteries. So that's maybe more reassuring, and that's why the patients don't report any complaints anymore and feel better after a year. Yeah. Based on our results, we can conclude that cardiac CT is more effective in women compared to functional testing, and also a safe and cost-efficient diagnostic method comparing to functional testing.